Hello. Hi. I'm sure I've gone live at the second. It seems like I have. I feel free to comment on the down below on your phone or to the sides with any feedback, comments or anything. So down there, it's like emergency exits on an aeroplane. It's probably the way I'll go. My name is Vicki, and I work at a busy small animal vets in Manchester. I manage the practice. I developed a huge interest in behaviour quite a few years ago, about 10, 11 years ago, because I saw a lot of vets struggle. So I've been in the profession 26 years this month. So I wanted to share some information with you about hi Georgina, some information about how we can help our pets, how we can help other people's pets, so maybe your clients at dog training, whether you're a physiotherapist, hydrotherapist, a client who's just got an interest in pets and behaviour and training. So basically it is just really about what we can do to change and how society has changed over the time about their dogs' welfare as well, because that's hugely increased and changed throughout the years. So this is my first live video to people that I don't know. I'm always doing them on my own page, so same as everybody else, bear with me. If there's anything that you want to know, pop it in the comments box or just say hello. So I'll start off by saying, yeah, it's a crazy world, especially at the second. We see poorly pets and well pets. So you've got the both. The well pets that are coming in. Hi Danielle. Hi Alison. The well pets that are coming in are normally pretty happy. We'll probably see them at first vaccination or even sooner for a health check if they're with the breeder. You could be lucky enough where you very rarely go to a vet's, but you could be really unlucky and you could be at the vet's quite a lot. So it's about changing that behaviour for the pet and also for us as the public, if you like, and us as a profession. Is to give you an insight as to why sometimes we do things the way that we do, and it's to try and help. Hi Sonia. It's to just try and help you understand our side of things, and to make the experience a bit of a better one. So I was saying about the well pets that come, they can be the ones that have just come for a yearly health check, or a booster vaccine or teeter testing. You're still gonna need to vaccinate against your lepto when you teeter test anyway. So we are still injecting, well, twice, once for taking the blood and then once for giving the lepto. So hopefully we're not going to traumatise the animal too much from doing something like that. And this all starts out, from an early age. So we're seeing them as puppies and we're getting them in as a health check. And we're trying to make it as lovely as possible, a positive experience for this puppy. You can generally tell it's the personalities are coming out, and as breeders will tell us, people have been and picked their puppies. Personalities are coming out in these little ones, from 3 weeks old, and that's how their puppies are being picked, or their next breed is being picked, next breeding bitch is being picked, all from such an early age. So if that can be done from that early age, it is really important to have positive experiences. They say, you can get loads of experience and come across lots of different circumstances up until 12 weeks old. And the puppy, all being well, should be good with it. And we've got to think about, they're not vaccinated, they're not finished on the vaccines. The earliest is 10 weeks old. Some places are 12 weeks old. I am just speaking generically. I'm not giving any veterinary advice, but just as a ballpoint, these are the ages. So we've got to consider, is it better to be carrying the pup around? Because pup shouldn't be on the floor if it's not vaccinated. It's okay in your back garden as long as it's secure. No unvaccinated dogs can get in there. You do run as much risk of running something in on your feet, unfortunately. The common one we get is there's cats that come in the back garden. The cats have just got the same kind of thing as to bring in. You can only wrap the bubble so much. We need to get some of that life experience going, and your first health check at the vets is hopefully a positive one. So that's checking things like ears, eyes, in the mouth, as if it's a boy dog, as its testicles come anywhere near down, just puppy look well, eating, drinking normally, no diarrhea, no vomiting, and seems really quite happy, roly-poly puppy. So hopefully that first experience is a positive one. Their microchip is now law, which I think is absolutely brilliant. And it doesn't have to be done at the vets if you like, so you can go and do a course and become a microchip implanter. Rightly or wrongly, whatever, that's done. So is that a positive experience that's being done? It's a large injection. So we've done the health checks, that's the positive experience. The thing that so that's a well puppy. The thing that we may well get is a poorly puppy. Now that puppy, could be 15 weeks old and have horrendous diarrhea. So we look at it from the simple point of view. I talk and explain things to clients and to people as in I was talking about us, because I think we seem to understand it a little bit more. So if you had an upset tummy, so you had horrendous diarrhea, you would have stomach cramps. You would feel off. You'd just feel quite tired, and you couldn't really be bothered with anything. You wouldn't want to go anywhere. You certainly wouldn't want to be dragged out into the car. You wouldn't want to be messed with, prodded and poked, because you'd feel like naff. But we have to see that puppy in order to get it the treatment that it needs. It's really important on something that is so young and sometimes so tiny. You're looking at like a little chihuahua or, in even something larger, Rottie or whatever. It's very young. And if we don't catch what's going on quickly, they can become dehydrated, more lethargic, and just generally whatever they've got can just overtake them. And so something that's so poorly, if someone was to ring and say they had vomiting and diarrhea in something so small, I would say get to the vets, because they're young. It's not fair. They come to the vets, and again we can't give them any treats to make it be better, because they've got a bad tummy. So anything that we give, we can upset it even more. And yes, unfortunately, we do have to prod into the tummy because these dogs can't speak. and so you're feeling if there's a tense abdomen. It's a bit scary being on that table as well sometimes when you're not well, you're on this table. So it's difficult to make it a positive, but what we can do is try and make it quick. So we get the examination done, and we give the puppy some nice attention. Yes, you're not well. Yes, we're going to get you sorted. We're hoping that we're doing the great thing. But come on, we'll get you better. Let's get you off that table, and let's get you out quite quickly. So perhaps maybe not a 15-minute consultation. And again, that's the vet's decision, because you need to get a correct diagnosis as well. But also owners are upset, and it's not just about us treating the animal, it's about us treating the human as well, because sometimes if that treatment isn't, the pet needs more treatment after that, a different antibiotic or anything, the dog is back in, another examination, and again we're trying to make it as positive as we can, because it is critical, and it can be frustrating for all parties, but hopefully from that we just get on. So seeing from the side of the poorly animals, that's just one example I've got of sometimes how difficult it can be, and that's where your fear of the vets can begin. So you could be the next month, I don't know, for example, say unfortunately your dog broke its leg. It's not a positive experience of going into the car with a broken leg or a damaged leg, and going to the vets. And what we want to do is try and examine the pet without causing pain. We don't want to cause pain, but we've got to find what is wrong with that pet in the time. So this is how things can, as a lot of you may know, called stacking. So you can get bad experiences, and from them experiences of reasons why they've had to go to the vets because they've been poorly and they've had to go a couple of times, they then become feared of the vet. So we want to change that fear. Certainly during COVID, this pandemic, seeing a lot of animals that obviously the client can't come into the building. We are allowing one person in at the second now with their pet. But before, you weren't allowed into the building. And the amount of people that were saying to me, he won't go with you. He won't go with you. That's fine. I'm all for keeping everything as positive as we can. So let's change that. Okay, if you don't want to come in, let's see what we can do outside. So I'm not the vet, okay? So all I can do is get all the information off the owner, stand with the owner outside, reassure them, and perhaps do a little bit of work with the dog at the same time without it actually knowing. I found out a little bit about what's wrong with the dog, and for those that are saying, he won't come in with you, okay. And I pop 2 leads on for security, okay. We see a lot of collars that are loose and not fitted correctly, so I want to pop my own on, and we are meant to during this time anyway, to make sure it's secure. I will then quite happily walk or trot or run up and down the street with the owner, with the dog, walking back and forth, and then I always ask the owner, don't pay him any attention, just ignore. The dog is looking to you for reassurance, the dog is looking to the owner for reassurance, but I want that dog to trust me, so I am running up and down, and then I'll just say, just wait there, and then we'll come, and then the dog will just carry on trotting with me, and the owner stood there. And there's been a few ways we can do it. Sometimes when people are allowed into the surgery, I say, just go in, and now the dog will turn round and then automatically go to follow its owner. That is good. Okay, so the dog will then enter of its own accord, and that's fine for me. The dogs enter the building, it's secure, they can speak to the vet without any road noise, communication is better. It doesn't matter at that point if the dog doesn't get into the consult room. I think if we try and communicate with our vets, and we explain that we are nervous. We're nervous because the dog's poorly. We're also upset because the dog's poorly, which we all know. Working in this environment, we know that people are upset in a lot of cases. So it is just working around that. And then you're looking at the other side of things like pets that are on medication, pets later on in life, whatever medication, heart medication, arthritic medication. You're having to go in for either 3-month checkups, 6-month checkups, yearly checkups, whatever your vets want their patients to have. We need to make that a positive experience. Pets like that are diabetic can't have treats. Pets that are in for operations can't have treats. Dr. Ian Dunbar learnt me a really excellent tip. He said, use the nose as a reward. So we can use a powdered treat, because it's not going to do any damage. I kind of do feel a little bit mean on the diabetic dogs, though. It's not something I would do on them, because Pavlov's dogs, smell of food, trigger of the bell, all the rest of it, creates your gut juices flowing and your salivary. So is it very fair to do that to a diabetic dog? I don't think so, and it's not something that I would encourage. I know it's like if I was on a diet, someone walked by with a cream cake, I'd be like, what's going on? It's not very fair. So we've got to think about trying to change the dog's emotion to a more positive one, but also not be indirectly. I think indirectly cruel about it, unintentionally, because we didn't mean to. We just thought at that time that might have been a good idea. But this is all a learning curve, and this is why we're all here, to learn extra little bits. Being in practice, I'm seeing from that side of things, the amount of times that people turn up and they're giving their dogs treats and the dog has got an upset tummy. Actually, is that making things better or worse? And a lot of scared dogs don't eat anyway. But when I try and do desensitisation to the vets, I encourage that particular pet and owner, come at a certain time, have a time slot, it's going to be quiet, there's going to be no one here, come into the waiting room, if we don't get the dog into the waiting room at that time, I'm not going to push it. There's no point in forcing something, you're going to make it even worse. We can just work to travel in the car just to get to the area, because it's sometimes, as soon as they get to near the building, that's too much. So we'll work on the journey, and this will take a lot of time. As many of you know, your desensitisation is slowly, and this can take months. And hopefully you will have months to get this desensitisation to the vets, to make it a better experience, and that you're not going to need us, hopefully. But if you do need us, then we've just got to work through it, haven't we? It's like being afraid of the dentist. Nothing ever good happens there, unless you're just going for a checkup and you've been lucky you've never had a filling or a tooth out. But when you've had a bad experience, you remember it, and you remember the smell as soon as you get in. You start your palpitations when you're sat in your car, you're paying for your parking, you get sweaty palms. You go in and it's like, you can smell all the cleaning products and everything else. Dogs' nose is hugely massive of senses. They're absolutely so in tune. So they have their scent glands on their paws. So, and their anal glands. And all this is on the floor. This is why, as a practice, it is cleaning constantly the floors and the walls, because them smells from scared animals are all in there. So we are trying to make it a better environment. So if a dog is coming in for a desensitisation, there's no time limit. It could be 2 minutes in the car. That's it. Off you pop. Bye. That'll do. Come back a few days later. Just like your training. Your training should be short and sweet. And I'm the world's biggest one for overstepping and going a bit longer than what I should. Should set myself a timer. Then the reason that's different is because we're getting so much out of the training. We're doing trick training and stuff. But when you're at the vets, you can see that little change. You think, okay, right, this is enough. Off you pop. Bye. But then we can gradually increase the time as to getting the pet to walking outside, and then eventually walking through the door and so forth. I've seen huge changes in lots of dogs, which is it makes me in awe of them every time, because they have the right to say no, just the same as what we do. No, I don't want to do that, thanks. They have an exact right to say that, and I'm totally in awe of that and respectful of that. What is the point of pushing? Okay, you're not going to get anything out of it. And we want to set this young dog up, the young dog, for another good 10, 15, 18 years, if you're lucky. And we want it to be a good experience and hope that you don't really need us. But if you do, it's got to be done. So my setups on my desensitisation is, like I explained, from the car to outside. I've worked with quite large dogs that I would have you. They would have you. They've been scared, they're poorly, perhaps not correct fitting equipment on them, bad equipment on them. I do not want to bully any client into saying, get that off, because they are coming to our door. If I am rude to them, I'm going to lose their trust. So, I've heard it in the waiting room sometimes where some people have said, oh, did you see the state of that dog? Did you see such and such thing? Do you see what that dog was wearing? Yeah. But if I was to turn around and embarrass them in front of everybody by saying, that's a mess, or why have you left it, or get that off, being in the wrong tone is going to make that client go, don't like her, not going back. If I've got them there for that few seconds, everybody else can judge on whatever they want to do, but my main priority is for education for that person. And for example, like skin complaints can come up within a couple of days. Dog eats itself alive, makes it all worse, nibbling away, and within 5 to 7 days it's really bad. People are quick to judge, just like in the dog training world. Everybody has an opinion. Some are right, some are wrong, and we're all learning at all times. And to me, it's not fair to that person, nor to the dog. Let's get the dog treated in the best way, be it whether it's lack of education or lack of money. They could be going through their own issues. So I never judge anything. But what I will do is I will try and re-educate in one way or another. So I think rather than being hard on. And then when they're in the room in privacy, or as we are working out outside at the second, it's them educating their owner, giving them options, and making the dog, sometimes you're seeing the dog is shut down. So giving them options to create a better relationship and bond with their owner. Seeing young dogs. Hi Ruby. Puts at the end of the day, so play tuggy with biscuits and no other dogs around for routine, urgent and non-urgent. Don't want to upset the others with tuggies. Yeah, you're so right. You've got to think about squeaky toys and the food, and everything else. Someone might be in for an operation that's nil by mouse, and the dog 3 seats away can be sat munching on biscuits. Is that kind of fair? Because I know if I'd had nothing to eat, I'd have been starved, and I wasn't given anything to eat, I'd be grumpy. And so that brings out the other behaviour in dogs, as in, I've not had anything to eat, what's going on? Oi, pointing at the cupboard, where's my dinner? Where's my breakfast? And then go into this place that stinks of anal glands, and sweaty feet and fear. And he's sat over there eating. Look at that. So it is about respecting the other patient. So sometimes it's about appropriate times. Yes, Alison, you're so right. Bucket game, Shrag Patel, amazing. Where the so I'll explain it. Where the dog is focusing on a treat pot. For example, I think I may have something in. Let me get this up. So that's how much treat bag. So this is your pot with your food in it, and the dog is focusing, and so you can go to near, I don't know, the shoulder area, but not touching, and it becomes the bucket game. So you're getting a treat for, you'd be hungry. I know, Danielle. It must be awful though. You think about it, it must be awful. So this bucket game is a fantastic tool. I like the bucket game, and I also like touch. It is something that I do with most of the puppies that come in. So if I'm lucky enough that I'm on reception and I see puppy come in with the owner, I'm like, oh. So bear in mind, you can see some behaviours coming out in these pups at 8 weeks old. You're getting the mouthing, they've got little children. Just you're building up that relationship with the person. Oh, he's a lovely puppy, how long have you had him? You're asking all these interesting questions. The owners are excited because it's new, and you want to put them in the right direction. Have you got somewhere to go dog training? There's lots of online ones at the minute. Zoom. People do not know. People do not do the research. They'll go out and they'll get a breed of dog. They've not looked into the breed of dog. I have Australian cattle dog. They're a very high drive dog. I want to say it's like Border Collie on speed times 10. Up there. But so good fun. But you need to look into what the breed is, and obviously, as dog professionals, we are seeing them comebacks of things. So from my side, your certain breeds of like your Yorkshire Terriers have slipping patellas, your Sharpies, they can have bad skin, sore ears, entropians, which are that eyelashes turning. Yes, we do see some nice Sharpies, and yes, some are happy, some are really, really grumpy. And I'll tell you what, if I had bad skin, ears, and my eyes were sore, I'd be grumpy as well. I wouldn't want anyone touching me, and I'd be pretty miserable. And then you've got your things like your English Bull Terriers, they seem to have bad feet or nails, a lot of them. And then you've got your floppy-eared dogs that are always end up with prone to ear infections, and it's whereas your German Shepherds are high up, and it's because there's no airflow, so it creates a bacteria of being flopped down. Um, yeah, Karen. Protocol on speed. And you would know because you have them as well. Yeah, so you've got your certain medical problems that are prone to certain animals. Like if I was saying to someone they've got a cavalier, you've got your certain conditions. But if we know that that dog, for example, say, I get dead excited about this because I'm like, oh, it's like predicting the future sometimes. It's not predicting the future, it's about setting it up for if it's going to happen. And then I hope it doesn't happen, but I'm hoping that I can give you some tools in your bag to go away with. So, perhaps as dog people, we need to find out, for example, your Yorkshire Terrier with slipping patellas, or like your Cavaliers with ear problems, that when we're seeing them at training classes, or in the vets, that we actually discuss, oh, okay, right, did you know that this Cavalier may be prone to having ear infections later on in life or any time in life? Oh, really? Yeah, because it's got floppy ears. I'm hoping you're not gonna, but what we'll do about it now is let's start to mess around with Puppy when you're at home. So, I'm dead, as you can tell, I'm always like this. I've got a deaf dog as well. She must get so confused. I do, the happy chat, where have you got him from, all the rest of it. And then he's a cutie, how the kid's getting on. This is all casual. It's and it's all really, really important. And while I'm doing this, I'm touching the little paws. I'm going over the head, and I'm going down the back, and I'm touching down the back. And then I'll have a look in the mouth, and I'll flop up their ears. And as I'm doing this, I'm then showing the owner I'm doing all this because this is what you need to go home and do. The amount of people what I see where you can't open its mouth. Yeah, you can't open its mouth because it's never been normal. It's not been normal. What's a good way to explain it? It's probably a really rubbish way of explaining it. If I had a jumper, right? So we've got this. I did have a jumper down it before. So I've got this thing with two long bits coming out, a hole there and a hole there, a big hole at the bottom. If I'd never seen a jumper before and nobody wore clothes, for example, we all went around naked, God forbid, I'd be mortified. I'd get my dock leaves out. If we was all going around naked and somebody had this thing, which we know as a jumper, and gave it to me, I would have no idea what to do with it. Right? Would I sit on it? Would I swing on it? Would I tie it up? I'd be a bit like a chimpanzee, wouldn't I? Or orangutan. I'd have big long arms. I could, you'd be pulling it, you'd be doing it, so you'd actually never realise that it was for wearing. And it was only when you would put it around you that felt warm. You would then naturally progress to, oh, there's a hole there. You could put your hole through a sleeve, your head through a sleeve. No, it's not going to fit. Nobody's shown you how to do this. My reason for explaining this is if we are not demonstrating to owners of what can be done to change, they're not going to know. And we're teaching them because we want to set them up to have this massive, this big tool bag on their waist and just get it out and use it. My dog, she's so funny. Those that know me, she is partly obsessive compulsive ACD. She came with trillions of problems. Some are management now, some are cured. You know, if you do something different with her, bearing in mind, everyone who works at a vet's, their dogs always get messed around with, bandaged up, played with, because we're seeing it all the time. But your key tools like your muzzle training and things like that, again, sometimes they're not being done, because I don't need to muzzle my dog. My dog's not nasty, as people say. Yeah, but dogs that are in pain, scared, can bite. Can you imagine something had happened to you? God forbid, let's say you were in an accident, and you had to be removed from a situation, and you had a broken leg, and you didn't have any medication to be able to take. You would want to lash out at that person who was actually trying to help you, because it really doesn't matter at that time. I'm scared, I'm hurt, and I want to smack you. Yeah, so this is why dogs bite. I'm not saying put a muzzle on, and that needs to be done. We want to try and alter that so that we can safely do something about the situation. We want to encourage the owners that we want to do the best for the dog. We want to give it its pain relief. But a dog that is really sore, to be able to lift up the skin to inject, is really scared. And what we want to do is change that so that it's not unusual for someone to be just tenting up the skin a bit, tenting up the skin. There's, you could go on forever about, well, we're not injecting. Yeah, we're not. But these little tools that are being provided of messing with paws so that we can see the nails look all okay, open up the mouth so we can examine in there, abscesses, tooth rot, decay, and just general care. Dogs with sticky out eyes like bulldogs, Frenchies, pugs, their possibility of needing eye drops at some point for some reason, bulgy eyes. So do we go down the lines of, okay, right, well, your dog's got bulgy out eyes. Are we going to do a routine of desensitisation for bathing eyes? Water, cotton wool, water around near the eyes. We're not causing any harm at all by using water. Okay, there's artificial tears, false tears, what we can just put in our eyes. You can get that from your vets, that can desensitise for eye drops, but speak to your vet on it first. Tell them your concerns. Say, my dog's got bulgy eyes, do you think about ever get an eye problem? What can I do to prepare for that? Is there anything I can safely put in that isn't going to cause any harm, so it gets used to having eye drops? Yes, there is, but speak to your vet. Okay. If we leave eye conditions, they can cause ulcers and stuff. So again, the sooner that treatment is given, hopefully the lesser risk of having a problem with the eye. Like I say, it's setting up for tools in your bag. There's been desensitisation for kennel coughs. Going in, I wouldn't want something shoved on my nose, but it's like having a vaccine. I don't want to go for a vaccine. There are ways, there are tools that we know in the veterinary profession the best way to do. It is only actually a drop that we need to get in, and I know the dog's a bit slowed out. That doesn't matter. But it is desensitisation where I have been lucky enough where the vet has allowed me to take over on the consult and do 5-10 minutes of going near the nose, but not even nothing in my hand, just a hand touch, which was going back to the bucket game actually, and the hand touch for mine, as well as the bucket game, which is giving them focus. Look it up, it's on YouTube with Shrek Patel. The hand touch for me is, let me try and do that, where the dog touches your hand with the nose and then you're rewarding that. my little girl's asleep, I would show you on her, but you know, she will stay there and stand there, and she'll look with her eyes to the side. From that, it is giving her something to focus on, and we can use that as a tool in the you know, directing the dog, giving them something to do. You can use it outside, you can use it in the vet practice. You know, I think just having all the tools, you know, things like nail clipping, desensitization for that. I've done nail clipping outside on the street. I've done it, well, you know, it's just a dew claw that's curling around where, well, you just hand touch or feed. I'm not doing anything. All I'm doing is going down the leg, feet. All the time, I crazy it up. I'm, you know, I'm like, no, come on, let's do this. It's not confusing the dog. It is. I really love that. Started off with the lolly stick. You know, ask your vet for an empty syringe. Because you want to desensitize to, you know, giving kennel cough. I don't see why they would say no. You know, drug addicts can go and get syringes from anywhere, so I don't see why. But, you know, for just going down, the only reason I'm going down the leg is I can just snip that bit of a G-claw off while the foot is planted on the floor. I don't need to do anything. If that dog is prone to having ingrown nails, then we need to work on desensitization for nail clipping. There is the, you know, well, we can just sedate or general anaesthetic and clip the nails. Let's work towards something where the dog is happy, rather than doing all this medication all the time. When, you know, you've got plenty of years with your dog, let's get it used to having its toes messed with. And again, I've had where the dog has not wanted to, you know, be in the surgery, having it done, so we're doing it outside. Lost my train of thought there. But it is just working on it, and also, like I was saying before, scared dogs don't want to eat. Some dogs want to ignore. So it's building up that relationship with your favourite vet or your favourite nurse, and doing that consult. Every practice is different. Some charge consults for doing something like that, some don't. Isn't it better that we try and persuade someone to just come in for a weigh and a play? A weigh and a play, and doing it, you know, seen quite a few of them. I've been doing quite a few of them, and I have been lucky enough to have another vet call me in to do that, which is fabulous. It's just, every case is individual, every case is different, every dog is different, we have different personalities, the owner has different personalities. So what works for one doesn't work for them all as well. So we've got to think out of the box. You know, like I say, I love trick training. She's a deaf dog. I need to think out of the box sometimes for that. And at work, I need to think out of the box because every patient is different. Every pain threshold is different. And we want to work with owners to help you, to help your pet. You know, unfortunately, we do see a lot of dog bites, dog attacks, and we also see a lot of people getting bitten. There's reasons that dog has done what it's done. You know, the common one is children get bitten, and the children that get bitten, unfortunately, is because they can't read dogs. They can't see the lip. They don't hear the grumble. They don't see the lip licking. They don't see the turning away. Kids are not reading this. And kids are at the same height as a lot of the time a dog's face. You know, the dog's on the floor, kid crawls over. You've all seen the horrible videos of kids clambering over dogs. And I can give an example because it was a friend of mine and I have been allowed to share. It happened quite a lot of years ago. Face paintings, been to a party, sleepover in a tent. Dog normally sleeps with the kid. You know what I'm going to say. There was a dog attack. And my guess was scary face. The kids had moved in the night. There was nowhere for the dog to go because it was enclosed in a tent. It was an unusual environment. The lighting was probably different, and that's why it happened. That dog you could have done anything with, apparently. But to give an example is scared dogs bite. And we want to educate the owners, and their kids. And that brings me to the other bit. My husband works at a non-mainstream school. Of children between 13 and 16. They've had some bad experiences. I was invited in along with my dog, who likes her own space. Okay. And she was muzzled in that environment. She was, used to wearing a muzzle because the children are unpredictable. I would protect my dog, that is absolutely fine. What we were going in was to educate them. It was to educate them on animal bonding and relationships. And if somebody has had a bad life or has problems, mental health problems, or it's like, I can associate that pets could be the same. Blue dog, she can't hear and she has problems. Showing them how I've turned that around, or that she can do something that's fun and exciting. Like on one day that we went, she was opening up all the little drawers, and it was just because I'd done one with her, and then I was just doing the sign with her for pulling out. And one of the kids said to me, "So what you going to teach her?" And I went, "What you've just been watching." She showed interest in that drawer. Let's encourage her to do something on that side. So it's finding an outlet for the dogs, and also for the children to associate, and they're our next generation of trainers. They are our next vets, our next nurses, all our animal care people, our kennel assistants, getting that interest and that little bit of education to them, and that respect. Okay, there's always going to be a mean person out there to say, let's have this respect. Look at the amazing things that you can do with a dog, with a cat. You can have care in anything. It doesn't have to be a big dog. It doesn't have to be a big, mean-looking dog. It can be a rat. How clever are rats? Is to plant that idea in their minds. And it's the same in the veterinary practice when we see puppy. I'm talking to the kids as much as to the parents. Oh, does puppy run after you? Does he pull your socks? Does he do? Yeah. Stand still. And my classic is I love and I can't remember where I actually learned it from, so I'm sorry I'm not tagging whoever it was stand like a tree. Okay, so you stood, your branches are all curved in, and you're still, and you shout mum or dad. No interaction with puppy. It's a bit boring. Just that one little bit of advice could be a saviour. So yeah, it's there's lots of ideas for stuff. I also mentioned I do some Tellington T-Touch, the very basics, I will say, and the T-Touch is for like nervous patients. It's a movement exercise. It's relieving tension. it can help with fear of contact and discomfort. There's in my area there's a lovely lady called Rachel Jackson, who does courses on that, and I do Reiki, way holistic. Some vets would be like, oh, it's rubbish. Yeah, but pets don't do placebo, and that's what I find fascinating. And we used to do acupuncture. Pets don't do placebo. I've seen some amazing results from acupuncture. I've had acupuncture myself. Acupuncture, along with Reiki, is clearing what they call the meridian lines. It's an invisible channel. It's basically your bloodlines. I've seen pets and they have the option to remove themselves from that situation. And I've seen some amazing calming effects from it. So I'm not going to knock it because I've seen it. And pets don't lie. Pets don't lie. They don't want to dominate the world. Cats do. But yeah. Has anyone got any questions? I mean, I don't know if I've been. Yeah, kids are can be more committed than adults. Yeah, right, Ruby. Adults are just so mean sometimes, and it is really sad. It's a shame it's illegal to punch them, but we're all force free. But I just kids are mesmerised by things, and if we're attracting them, to want them to be, they're going to be pet owners possibly at some point, and the kids in the non-mainstream schools, as I was saying, it gives them something to focus on. It gives them something to look towards. We've got to do something about it, and seeing their faces. Some don't want to know. Be honest. Some can't really give a damn. But they will stay still. I don't know if it's because the dog's there, but they'll stay still. They won't walk out of the room. Now, every other lesson, they would just walk out if they don't want to know. Yeah, and they do have fantastic timing, and I love all the questions that they ask. They ask some amazing questions, and certainly give you food for thought sometimes. It's interesting, really interesting. I would say do keep in contact with your vets. Hi Sonia, is there any advice we can give to owners before getting to the vets to lower the stress? Okay, yeah, for sure. Firstly, we want to try and to lower the stress. If the dog has got a problem or is anxious and known to be anxious, we want to try and pick a quiet time, so that that pet is not waiting in the car long, then it's not busy outside. Is it the vet or the nurse or the assistant that the dog has seen before and had a good experience with? Pets, obviously, like we said before, if they're ill in some way, food is not always the way to go, unfortunately, and we need to find out beforehand whether that be the right thing to do or not. But also, pets that are poorly or anxious, if you fed them anyway, they're going to be sick in the car. That's not a nice experience. So I think there are products which you can buy over the counter, things that have been proven, like Adaptal, which comes in spray form. You can put it on a bandana, you can spritz the car, but you need to all let that all calm down before the pet obviously gets into the car. We've used it around practice. We have plugins. There's Pet Remedy. There's Carmex and Zilclean. It's finding what works for your pet. Do them products help just lower a little bit? There's Pet Remedy wipes. I think it's also important for people to lower the stress levels, to be honest, because I think sometimes the pet feeds um, off that, and can make them more anxious. And like what I was saying before, sometimes it's not just the animal that we're treating; it's also the owner. Um, if they're going in for an operation, go in at last minute. So you know, try and get to your time slot. Um, Hi Katie, I've been using treats, hand touch for clipping nails. Is there anything else I can do? Stop her arousal levels increasing as she ends up moving, which makes the trainer's desensitization harder. Okay, go back a few steps. So, and if you've got the time, do, you know, a little bit, 1 minute every day, if that. It's possibly that you may just have gone up that step a bit too far, and then sometimes when you do that, it knocks you down quite a few steps. So reduce that, and just see if you can get an effect on just doing the even touching of the paw, and keep at that for a real good time. I think is the best advice, and you actually know where I am, which I'm happy to help you with. I am happy to help anybody. I do have a page. It is free. It is called Deaf Dogologist. All one word. It's my word. It's no such word, but it's my word. Deaf Dogologist. I can happily put it in the comments below. I think I'm allowed, aren't I, Ruby? And if you know, you would send me a message going, you know, what can I do about, I don't know, muzzle training for going to the vets or something, I can pop a video on for that. I'm a realist. I show my mistakes as well because I make them just as much as anybody else. And yeah, it's freebie and it keeps my mind going. Hi Kelly, my 14-year-old high anxiety, all the holistic guys do not work for her. She ended up on high dose meds. Yeah, you're dead right. You know, she's 14-year-old, high anxiety. Perhaps you also, I will quickly get in, the certain medical conditions which can cause problems. You know, you've got your things like your hypothyroidism, your arthritis, you know, disease and illness affects, you know, liver, kidneys, all them affect behaviour and bring out strange behaviours and different behaviours. Dogs that have undiagnosed thyroid conditions can have erratic behaviours and ignorance and you know, ignoring and just weird behaviours, if that explains that. So I'm guessing she's on high dose meds from your vet, and probably blood tests have been done. Yeah, again, it's really not anything medical. There's like probably 50% of behavioural cases that are actually medical, as probably Danielle Beck, clinical behaviourist, will tell you. Yeah, I think you're right, Ruby. I have probably 2 minutes left. God, I can talk the hind legs off a donkey. Poor donkey. We've had quite riddles with Carmen drops here. Have you? Yeah, I think our Carmex would probably be similar. They're all along the very similar lines, aren't they? There's lots of different drops. I've come to this late. I had my friend's lab damaged disc in her neck and was a real mess. Yet her acupuncture results amazing. Acupuncture, I just love it. Yeah, no, and I will tell you, as obviously working with a surgeon who has done acupuncture, who's one of actually the first animal acupuncturists, up to 8 treatments, and he said if it's nothing after 8 treatments, then forget it. I've seen firsthand really loads. A bitch was, you know, they wanted to come into season. It's not come into season. We did acupuncture and it walked out the door, got in the car, and came into season. Coincidence or what? I don't know. But how amazing. Thank you, Ruby. Yeah, I full named you. Alison, brilliant, handling at pet classes, and I you know, hands up, yes. It just makes life so much easier. Oh, that's great, Kelly, in that you're getting the regular blood tests and things and checking. Oh, I'm sorry she's got dementia. I hope you're coping okay with everything with the arthritis as well. Um, yeah, CBD all just got something. Yeah, L-tryptophan is fabulous. Um, right, I think my time is up. I kind of hope you've gone away with one little bit, and I hope I've not lost track of the topic. Um, and I would just say, work with your vets. We're there to support you and help you, and I have this huge interest in it all. And I wish that I could, help you guys a bit more. Keep it all kind. And I think next up is Cyan Murphy doing training for giant dogs force free. Enjoy the rest of the weekend, guys. Thank you so much for listening. Bob in the comments, if you've got any comments, I can always follow them up from when the video's finished and redone. Thank you so much for inviting me, and I will love and licks. See you later.